We are in trouble. So we're back all above 500 cases. Okay. It's coronavirus day 518, phase 3, day 28, and we have reporting 513 coronavirus cases. So since June 13th, this is the highest we've actually got. And then July we were had no cases, and then bang, and then bang, it went back up again. Woo. So for those of you who had summer plans, sorry, you might have to cancel. And this is why in my previous video I mentioned how vaccine certificates. So vaccine certificates will be pretty useless against wave 4 and also high cases. No, because that's not going to fix anything. Nothing. It will not. Today's case reports. Okay. Toronto is in high cases with 105 cases. 70 is from York Region, 64 is from Peel Region, 44 is from Durham Region, 29 is from Hamilton, 27 is from Windsor-Essex Region, and 25 is from Simcoe Muskoka Region. Joining us this time. All other regions reported under 20, so that's danger, danger. No deaths were reported today, so okay. This is not the first time variant cases. UK variant cases are at 145,641, which is +9. Check that. South African variants, fourth least variant is still at 1,493. It's been 12 days now. Brazilian variants are our third major threat. 5,176, which is one less compared to yesterday, so -1. And India variants is at 5,873, which is the increase of 148. So and also phase 4. Talking about phase 4 for a sec. So we got 3 weeks have passed. and over 80% have been vaccinated. Let me just pull up the information. So 81.22 is fully vaccinated. The only percentage we actually need is 2.47% more people vaccinated, and then we can get the approval for or move on to phase 4. But we need to also think about wave 4 of coronavirus as a major concern. And Dr. Peter Juni has said we can't just reopen right now because we're gonna slowly, gradually have to do it because of possible threats. Phase 3 and 4 rules are down below. Check. So I'm gonna so there's my topic today is has to do with new rules on managing COVID-19 cases and outbreaks, including in schools. So let's start with the general stuff, okay? So vaccinated Ontarians will be subject to fewer restrictions and more lengthened isolation requirement compared to people who are unvaccinated. And also they're going to do that for the school. Check. So rules for vaccinated people, okay? So Ontarians who are vaccinated who are not required to self-isolate but should get tested. But if they are sort of at risk if they're sort of at risk with a confirmed case or something, if they went to someplace and then there's an outbreak or such, so they should go get tested. That's going testing, but there's that. They should also self-monitor for any symptoms for 10 days. And also follow public health measures like wearing a mask and outside their household, and pretty standard, okay? Yeah. They're also instructed to quarantine and also get tested if they have symptoms. So members of the household don't need to quarantine or anything. So basically, a vaccinated person is exposed to a confirmed case, and develop symptoms, they must self quarantine and get tested right away. And if they're tested positive, they must quarantine. They must quarantine for 10 days. Okay. And if they have gone better, they can stop. So members of the same household don't need to get need to self-isolate if they've been vaccinated, but they have not been fully vaccinated, they need to also self-isolate as well. No. So unvaccinated people. So people who are have not gotten the vaccine yet at all. In this situation, so they need to quarantine for 10 days and immediately get tested. And if the test is negative, a second test is recommended or after day 7 of that that quarantine period. And so apparently they still need to quarantine even if they get tested negative. And this has to do with wave 4, I'm assuming. So if the person who is not unvaccinated has no symptoms, fully immunized household members don't need to self-isolate, but they aren't vaccinated, they should stay home except for essential reasons like work, school, or some other important work stuff. So if the person who was exposed and isn't vaccinated does have symptoms, that they must be improving for at least a day or at least up to 2 days for quarantine can officially end. Again, so fully vaccinated household members with the non-vaccinated person don't have this quarantine, but people who don't have their shots should quarantine while the exposed person is awaiting test results, and then quarantine and then stay at home for essential reasons, except for essential reasons during the exposed person's isolation period, 10 days. So schools, okay. So schools, how they're gonna work? So it is defined an outbreak in the school or childcare setting as 2 or more lab confirmed coronavirus cases in schools, staff or visitors where at least one case can be linked to a school or facility, including related transportation like busing. So measures will most likely be dealt with the local health units of the region, and can be scaled up or down depending on the specific situation and risks. So apparently, so some examples of the steps health units can take care of is a school outbreak. There is a specific signage for the restricting visitors, minimizing the movement of staff between cohorts, and limiting the activities of students in their own cohorts. And also schools might be shut down temporarily. So the likelihood of a school being shut down is pretty low with a high immunization coverage. Except for children under 12 years old. So public health units can shut down schools if the circumstances for an outbreak. So if an outbreak happens, the health unit has every right to close it. So students and staff who have symptoms should get tested and then isolate while they wait. Unless the person is deemed a probable case or test positive. So dismissal and isolation of asymptomatic contact in school is not recommended. If a symptomatic person tests negative or their illness is diagnosed as something other than coronavirus, like maybe the common cold or something, they can return to school after symptoms have improved for at least 24 hours. If the symptoms are that's the gastrointestinal, they should wait at least up to 2 days. So the usual wait day is 10 days, and quarantine day is 10. So if you go to school, or if you work at a school, or teach at a school, please be careful if you. These are the rules for September. Hospitalizations, 116 patients hospitalized with coronavirus. 113 ICU patients and 76 ICU patients using a ventilator. They have not updated long-term care home death reports since August 5th. So 7 days now. It's been a week. So follow coronavirus safety rules and regulations and phase 2 rules don't have the large gatherings over 25 or for the safety of others. And please, if you are eligible, get vaccinated. I mean, we're not forcing you to, but I mean, but if you're traveling domestically within the country to another place, to another province, yeah, or if you're traveling internationally, you should, and you, and you need to make sure like if you meet the requirements, because some countries don't like mixing vaccines, and same with cruises too. So stay safe.